Hi, everyone. You're listening to Let's Connect. This is LT.
And this is Ronnie.
You might also watch this conversation that we are having today with Dr. Sanjin. And Ronnie will provide you guys with an introduction in a little bit. First of all, we want to say why we're all here together today. It is because we are going to be talking about bullying, and that she will provide us with some insight because of her experience and where she works, and also life experience in general, and knowledge when it comes to bullying. If you haven't listened to our bullying series yet, please go do it. We have some interesting episodes talking about bullying. What it is, what it's not, and also talking about cyberbullying and some protective factors. So meaning like what are some of variables out there that help individuals who suffer bullying experience like the consequences of bullying in a less significant way, right? So they don't develop the mental health conditions or illness as other individuals. Because it's also important to know what it is that they can do or individuals can do to help them to cope with the bullying, right? And one of the things that we did talk about is that the number of people enrolled in a school in the United States, which is over 76 million. It's almost 80 million in 2018, according to the census. So it's probably a little bit more. We also know that because of the COVID-19, the number might fluctuate and whatnot. But so if you're thinking about how many children and teenagers is, the amount of time they spend in a school environment per year. And we also think about it, so research shows basically that 1 out of every 5 students report being bullied. Some other reports actually say that 1 out of every 4 children are being bullied. And so those numbers are high, right? And again, thinking about a classroom setting with 20 students or more, then you're thinking about how many students are actually being bullied. Again, the number is very alarming. And I think it's important to reiterate or talk about the definition of bullying again. And bullying has been defined as, so bullying occurs basically when an individual is being repeatedly harassed or teased or made to feel inadequate by one or more individuals. And there's an imbalance of power or strength. And bullying can take place in many forms, right? It can be physical bullying, it can be verbal bullying, and there can also be indirect forms of bullying, such as social exclusion, rumor spreading, and cyberbullying. So it goes beyond the traditional way of thinking of bullying is just verbal bullying, so there's much more that is just this word, this umbrella of word encompasses, and I think it's important for us to pay attention to. So without further ado, let's talk more about bullying and what it is that we should be paying attention to when it comes to bullying.
Sure, LT. Thank you so much for that introduction. And I think it is a topic and a conversation that is a must-have, especially right now in the United States and really all over the world. It's a topic that may be passed by as kind of a occurrence that just happened. But as we talked about on our previous podcast about bullying, the research shows that there is long-lasting effects, right? So this is a serious topic, and there could be maladaptive and detrimental processes that occur. But luckily, we have Dr. Sanjin here. So we got a lot into research and definitions on our first few podcasts. And today, it's great to have someone with some experience and some insights. So I'm just going to read a brief bio, and we'll get started, okay? So Dr. Sanjin is a licensed psychologist in the Southern New Hampshire area. She earned a Master of Science degree in Clinical Psychology and a doctoral degree in Counseling and School Psychology from Rivier University in Nashua, New Hampshire. Dr. Sanjin completed her APA-approved predoctoral internship at Rochester Institute of Technology and the Priority Behavioral Health Internship Consortium and her postdoctoral training fellowship at Hillside Children's Center in upstate New York. She utilizes various forms of evidence-based treatment into her clinical approach, especially in dialectical behavior therapy, in which she pursued additional training during her postdoctoral training year. Dr. Sanjin's clinical interests include trauma-informed care, systems-level consultation, family systems, supervision, psychological and neuropsychological evaluations, and supervision. So without further ado, welcome Dr. St. Jean.
Thank you. Thank you for having me. I'm so excited.
We're so excited to have you over here.
Yes. And as we were mentioning in the introduction, we couldn't think of a better person to come on and talk about this topic with us. And of course, we're talking about bullying today. So as we know, you have a history of working in school environments. So we just want to know, what are your thoughts generally on bullying?
Yeah, so I think generally, bullying is something that we have either experienced firsthand, we've witnessed firsthand passively. Maybe we've been involved in it and we didn't know, either being the bully or the victim, or we've seen it as adults. So, it's not just kids who can get bullied. And I think that's often it's a misperception that it doesn't stop when you graduate high school. It can happen in college, it can happen in the work setting. But it's very important that we focus on the school setting, that K through 12, where we are really teaching social skills. We're teaching and modeling how to interact and how to treat others. So it's really important that we focus on that, we talk about it, we address it, and we make sure that it gets the credit that it deserves, that it is an actual thing. It's not just teasing, which is it can be a separate thing, right? We have fun teasing, which can be reciprocal with a friend, just joking around. But then there's actually very severe bullying. It's a spectrum. So I think it's very important that we talk about it at throughout the developmental levels. And what that looks like through, it looks very different from a kindergartner versus a 12th grader, and how that's going to manifest. So it's very important, and it is all around us.
Yeah, and I'm glad that you brought up the point that it can happen as an adult, right? And we're talking about a workplace environment as a place where bullying often occurs in one of our episodes too. So I'm glad that you brought it up too, because we often don't have this type of conversation in other circles. And so well, that you could be experiencing is actually bullying, I'm like, no, but I'm an adult, bullying, what are you talking about? Am I in high school again? So I think it's important to pay attention to that. And the other thing is yes, I think it's very important to start having this conversation with children and parents of children, when the children are still in a child age, so that we can hopefully shape behaviors, thoughts, feelings, or whatever, and just change society as well, so that bullying is something that it stops, right? That it doesn't occur again. Yeah, and with absolutely. That, I do have a question for you. So a lot of people, right, of different ages, so possibly older adults or some adults that still believe those beliefs of those older adults, if that makes sense, they would say that bullying is something normal. It's a normal process of school, and that they were bullied before and they turned out all right. So what would you say to those individuals that believe this?
I think that people perceive bullying as, the definition that you said, right? To be bullying, it has to be unwanted, typically aggressive, and that could be aggressive in different ways. So physical strength, it has to be something where there's a perceived power indifference. That's really what it comes down to. And the power indifference can be anything from physical strength, popularity, access to embarrassing information even. So that power indifference, that can be seen anywhere. And when we really take the definition of bullying, we see that it's a lot bigger than just the teasing and being mean to each other. And I think oftentimes we don't really expand that definition for what it is. We think about bullying, like you said, oh, am I back in high school? So when we really pick apart what that means and operationally define it, it does happen everywhere. And if you want evidence of that, just go on social media. Yeah. That's all it takes. I mean, people bully. We have people that are in offices that bully, that people are looking up to. And so it is a very normalized thing, but just because it's normalized doesn't mean that it's inappropriate or that it's right to do. But I think that as we evolve and we shift and we have bullying, which I guess originally started in schools or in person, Now it's shifting to more of that cyberbullying, and we're seeing it in different platforms and different environments. So it's very hard to say that bullying doesn't exist as an adult. It absolutely does. Even if you aren't aware of it, doesn't mean that it's not real. It's just oftentimes we don't slow ourselves down enough to think what is actually bullying, and what does it look like. It's a lot more than just being teased. If that makes sense.
Oh yeah.
Definitely so. And you kind of touched on the next point that we wanted to get at, which is kind of why it may be written off sometimes, right? I think that, we talked about the media aspect of it in movies. Oh, this individual's bullied, it's not a big deal. And even in school environments, work environments, there's almost this notion that it shouldn't be reprimanded, almost like, stop doing that, separate and continue going throughout the day. I'm wondering, just from your experience, is there any particular kind of variable or reason that you feel that this is the norm, where it's almost accepted, however, they can cause definitely negative effects, excuse me?
Yeah, so I think it all starts with adults. It starts with how adults respond to it. If people are, typically we see supervision if we see bullying, we see it in unsupervised areas. So I'm thinking school specifically. In the school setting, the likelihood of bullying happening directly in front of a teacher is going to be pretty slim. It happens, but might be verbal bullying, where the teachers just say, cut it out, and they have the ability to separate or stop the situation from happening. The actual bullying that is very damaging is going to happen in the lunchroom or the hallways or places where teachers or staff or supervisors aren't necessarily around. So again, just because they don't see it doesn't mean that it doesn't happen. So I think that it starts with adults, and it starts with how adults react to it. It starts with the policies around it and what happens as far as the consequences for bullying. So I think that the way that adults and administration handle it has a huge effect on whether or not it's going to happen and to what degree. We know it's likely going to happen, but again, to the extent that it happens and the severity that it happens. I think that adults really do hold the power to what that looks like. The thing is, we know it's going to happen and we're going to expect it to. So we need to get ahead of it. We need to be doing something about it rather than just waiting for the students to come to us to do something about it. Kids are often afraid of being tattletales, or that if they do that, then they're going to be bullied more, or that people won't believe them. So there's a lot of real issues when it comes to not having a structure to address bullying. So it starts with adults, and we have the responsibility to handle it and manage it. It falls in our hands.
Yeah, and like you said, it can be very difficult for children, for teenagers, for anybody, even adults, to express, to tell somebody else of a different position, like, this is happening to me. If it's really hard for a child, it can also be just as hard for an adult, because again, it can influence. We don't know if the person who is causing that experience is someone of power, right? Because it can be a supervisor, it can be a teacher, it can be a coach, it can be your teammate as well. So we don't know who's going to be causing that. And the other thing that you mentioned, and it's striking me now, is that the teasing, like you said, that sometimes teasing, like among friends, it can be acceptable, and for bullying to be perceived as bullying is something that it's not okay, right? Like, this person is not accepting that. And it's something that Ronnie and I talked about too, and it keeps in my mind, is that like a lot of people who are victims, survivors, who are experiencing something as a significant experience such as bullying or other types of experiences that will affect their mental health in a very negative way, they are sometimes being like, they portray being okay with the situation because they're afraid also to say, hey dude, I didn't like this. hey buddy, like stop this, this is messing me up, this is messing up my mental health, it's making me feel depressed. They're not likely to express that. So sometimes the teasing can appear as like something that it's okay to happen when it's actually not okay. And that makes it also like a very gray area to like, okay, how do we tell people, empower those people to say like, it's important to set those boundaries and say, I didn't like this joke.
Yeah. So that's a really good point, right? Is sometimes we go along with it because it's a lot easier in the moment, like, oh, haha, that's funny. Like, you're right about that, whatever it may be. What makes it or constitute bullying is if it's one-sided. Are two people in on it and they're going back and forth, it's reciprocal, it's positive. But even if the person isn't expressing it verbally, if it's just one-sided, that's bullying. Like black and white, that's what it is. So I think that it's very difficult in the moment to say, I feel blank because you did this and it's causing me depression. I mean, we have a hard time expressing our emotions and talking about our feelings just in general. So if you put someone who feels that they are less than and they're talking to someone in a position of power, it's just not going to happen. It's just not. Or they're going to feel that they're going to be bullied for saying something like that. So again, I think it goes back to in that moment, and research does suggest that the victims do not find it helpful in that moment to say something, right? That might not be the case. The best way that we know how to handle bullying is splitting the two up. And it's not possible in every situation, but ideally what you want to do is you need to split the victim and the bully up. The idea of having a peer mediation is likely not going to help because there's still that power indifference, regardless of if there's a mediator there. The victim might just say like, yep, I'm okay, I'm fine, just to get out of that uncomfortable situation. You need to split the two up. You need to talk to the bully and you need to talk to the victim. Instead of trying to have a victim discuss how they're feeling or, hey, you need to stop that, that's bullying, where it might be hard for them to do it. What's important is that we nail down having a victim feel safe enough to go to a trusted adult, to go to that supervisor, to go to someone else who might have more power or authority, or even another friend, and talk about it with them and let them know how you're feeling and go through the conversation of, can you tell me what about this situation makes you feel like it's bullying? That's really the best way to approach something. Say a child, and I've had this happen in schools, and they come up and they say that they're being bullied. First thing is I'm going to believe them because that is how they feel. And I'm not going to say yes or no that feeling's right or wrong. It's how they feel. So the response is always, can you tell me what about the situation is making it bullying? Sometimes we see that as they're talking through it, it might not necessarily be bullying. It could be something where the bully, the perceived bully, actually might just have poorly developed social skills, and they genuinely might not have meant it. It's not that when bullying occurs that it's coming from a negative place. It's that someone might not have realized that they hurt someone's feelings. So it's important that instead of trying to go directly to the bully and addressing that, going to someone else, working through what about it is the core problem of the bullying, and then maybe working through some role playing or some modeling of a conversation that they can have with the bully, or that an adult can intervene and have that conversation and address it appropriately, and making sure that there are appropriate policies in place, whether that's a workplace or a school or a team of some sort, and it is known and everybody's on the same page about what happens when bullying occurs.
So for that, Joe, it sounds like we are to equip parents, school administrators, and whatnot, and other teenagers with the ability and sensitivity to talk to each other and listen to each other. And a lot of times I think that they lack the vocabulary, and I can say sensitivity, but that might not be the right word or the adequate word for it. But I think you guys understand what I'm saying, like to have the empathy, and also like, okay, let's sit down and like, what is it, that makes it bullying, to ask those questions that will lead to a constructive conversation rather than also judgmental, I guess, conversation.
Absolutely. There needs to be an open door policy always. That's step one, is there has to be an open door policy. So that person feels comfortable, even if it feels uncomfortable talking about it, they know that they can go to that safe space, right? There's a comfort in that safety. I think what we need to be doing is, along with the open door policy, is really praising positive conflict resolution. Maybe not directly with the bully, but the fact that someone came to that safe space and is discussing it is huge.
Right.
I also think that oftentimes we hear of there's a zero tolerance policy on bullying. That makes sense, right? We don't accept bullying in any form. However, there's actually typically a reverse effect with that. So for example, if you have, say, someone was teased in the cafeteria, that bully is going to be suspended, right? Or something where a kid was beat up and it's very much more physical, it's escalated, it's more intense of bullying. Both of those situations are bullying, yes. But if you have the exact same consequence where, say, you get suspended, then it's really not addressing the root problems if that's just automatically, I know I'm just going to get suspended if I do this, so whatever, right? It needs to be a logical consequence. So for example, if there's someone on a sports team who is bullying someone, or they get caught bullying, maybe their logical consequence is they sit out a game, or they aren't allowed to be with their friends in the lunchroom. Or if bullying occurs in a locker room, maybe it means that that student doesn't get dressed in the locker room as a consequence, where they like to be with their buddies and hang out. So it really needs to fit the situation rather than an all or nothing. We know that logical consequences work when it comes to behavior therapy. So when it's zero tolerance and it's always the exact same thing, the likelihood of somebody going to that safe adult or that safe space to talk about bullying and say they're getting bullied, the likelihood of them going to it is going to go down, and the amount of reporting is going to go down as well. If it's not specific to the case, specific to the person, it has to be addressed individually based and specifically to that situation every single time for change to actually occur. Because think about it, if there's a kid who maybe has some oppositional defiance, doesn't like going to school anyway, we know a characteristic of bullying in school might be that, average to low average grades, might not like school, right? They hate school.
Mm-hmm.
If they just go and they punch a kid for fun just so they can get suspended, they're getting out of what they don't want to be at. That's not helpful at all. So it really has to be specific. And that open door policy is so important to have. And I think that if you have logical consequences, it's naturally the open door policy is going to thrive in a more appropriate way.
Mm-hmm.
Definitely. Thank you for sharing that, Dr. St. Jean.
Yeah.
We talked about some tactics that could be useful in the school environment and maybe translate over to the work environment as well. I'm wondering, from your end and from your experience, what are some ways that parents can bring up this conversation as well? Because as we've mentioned, maybe the individual who is experiencing the bullying may not be able to express themselves or may not want to. So if a parent sees some signs of bullying, do you have any input on a way to start that conversation?
Yeah, so I think as LT said, one of the most important things is approaching it non-judgmentally, right? Is not having a parent automatically jump to the conclusion that their child maybe deserved what was coming to them, or the complete opposite, right? Is that they get very protective. We like to protect our children in any way possible. So sometimes they put that defensive barrier up and they don't really help the situation as far as resolving it. They get defensive, and that's not very helpful. If a kid is coming to them, they need to be able to express themselves without maybe even necessarily having the parent say exactly what needs to happen. They just need to be heard. They need someone who is going to be safe and someone who they can trust to just express what happened. And I think it goes back to that same question. Can you tell me what about the situation makes it bullying? How did you feel about that? Walk me through what happened. How did you feel when this happened? What about the end? Maybe just brainstorming that with open-ended questions on what do you think is the best way to approach this? How should we solve this? Then I think it's important that, you know, we know that a system of adults is going to be the most effective way, because a parent can't go to school with a child. So we need to make sure that there's a support system for that child where the parents can get in touch with the teachers or the administrators, and making sure that there's someone in the school environment that's aware it's happening. And if that means that the parent has to be the one to say that, letting the child know, right? So that child doesn't get completely sideswiped knowing, oh my God, like my parents outed me to my teacher and now I'm, you know, completely mortified by this. So making sure that they're aware, that they know this is going to happen, that they're going to tell the teachers, and just approaching that very gently. And so that way the teachers or the staff can just maybe increase the supervision a little bit more around that student, maybe giving them a little bit more grace when they come to school very anxious or looking depressed or very withdrawn in some way. Noting it to the school psychologist or the mental health counselor, and vice versa. When it happens in the school, anytime a student is bullied and it is brought to a teacher or admin or staff, there should be a call or an email to a parent or someone in the home setting, the caregiver, not necessarily a parent, but the caregiver should be made aware of it in all situations. We need to make sure that there is a wraparound support for this student rather than just one-sided, because if the parents know, but the teachers don't, it might not necessarily be effective for the child. So we have to work as a team when it comes to bullying.
Our concern here is that, I mean, what you're saying, it's the ideal world, definitely. And we want to hopefully get there sooner rather than later. There are several concerns. One right now that jumps in my mind is that some children, they don't have a safe environment at home, and they are being bullied at home by their brother, by their father, caregiver. And then so now we're having the school call the caregiver or the home environment, and it's possible that the child will then suffer greater consequences when the parent or caregiver learns about it. So is there a way that the school can sort of discern what might actually, I don't see, it's just a concern, because it's not up to the school to decide what's necessarily like the best thing for the child, right? It would be, I guess, like the eyes of the law would be the parents. But if the parents are the ones that are also causing difficulties or adversity experiences for the child, then we're thinking like this is probably not the best idea, the ideal action course to take here. So.
Yeah, you bring up a really good point. It's really easy to talk about these things in the ideal world, right? Like if in an ideal world, a child would get bullied, automatically everyone would know, there would be some conflict resolution to it, the zero tolerance policy wouldn't happen. Like that's in a perfect world, but you're absolutely right. Sometimes they can be bullied in their own home, or we haven't even tapped into what happens online. Right. Yeah. We're talking about things that happen in school. So there are definitely different environments where bullying or which is trauma evoking often can happen. So I think in that sense, what's very important is making sure that there are alternative outlets for a child, right? We can't, in the school environment, there are limitations as far as what we can do for what that child experiences in the home. But what we can do is we can make sure that they have positive role models. We can get them set up in extracurricular activities, right? If being in the home environment is not a safe space, what can we do to get them out of the home environment into a safe space where they are surrounded by people who are aware of the situation? We also want to make sure, are they getting the proper nutrition? Do they maybe need meals sent home, right? We need to look at the entire scope of this systemically rather than just looking at the bullying, because again, what is at the core of it? Is there discord in the home? that is often a sign of actual bullies, not necessarily just victims, but we also have to look at the other side here, that there are the bullies. One of the characteristics of a bully, not always, but it can be that they're coming from a very chaotic home environment. So we also have to look at the reverse. Rather than just addressing the victims of bullying, let's look at the people who are doing the bullying, what is happening in their home environments, and what can we do to be proactive to prevent the bullying from even happening in the first place. And that could be something like even social skills, parent training, having a liaison going into the house where there's a little more security for that child, and a connection between the home and school. So you really have to get creative, and it has to be individualized. Again, it's not going to look the same for every family or for every student in every situation. But it's really hard because, again, ideally, it would be very simple to handle bullying, but it's not. It's messy and it's complicated. It's a complicated situation. It really is.
Mm-hmm. And then we have cultural barriers, right?
Yes.
Cultural beliefs. And that is not just necessarily like people from different countries per se, but also within the United States, the way that people from like, I don't know, I'm just going to say, throw out like state names here, like Connecticut is different from the way that people in Texas think. I don't even know if that is true. Okay, I'm just like listing names here. But it can differ, which means that it will influence the way that bullying is handled as well, right? The way that we talk about our emotions. And like as I mentioned before, the other concern is that like, how do we equip individuals? Even like we were talking about friends, like how do we equip a teenager to have this type of vocabulary and ask the friend to express their feelings other than just like, hey buddy, get over it, or yeah, that sucks. And so what else can we do?
Yeah, you bring up a really good point with the culture, right? Especially in this climate that we have, where there's a lot of moving parts here when it comes to culture, racial disparities, social economic disparities. That is absolutely true. We also know, punishment, for example, in the home might look different in different cultures. And then what is that child learning in the home and then bringing into the school environment? So that's a very important thing to note, because it's going to look different in different parts of the country and the world. So I think that's an extremely important factor to note. But yes, I think that really normalizing, how do we get people or adults and children to talk about their feelings, to talk to their friends about maybe if they've been bullied by someone, or if they think that even though they're friends, just because people are friends doesn't mean that they can't bully each other. That's a misconception. So how can we get people to start talking about it? I think something that's really helpful from a tier 1 intervention would be getting social emotional behavior curriculum and social skills training into the schools and into the classrooms. So it's not just, we need to look at this systemically, not just having social skills where children who might have an IEP or sees the school counselor, they might have their specific social skill group or their lunch bunch or something like that. But we need to get evidence-based training in groups in the classroom, so all students are having it and all teachers are getting the education and the training to know what to look for with bullying as well. So I think looking at it systemically is very important. Looking at it systemically to get the curriculum in the classroom, but then looking at it systemically to know that there's going to be cultural barriers, there's going to be cultural influences, and what does that look like? Especially if like you said, Connecticut versus, Texas, if you have a student that's coming from a different part of the country, their previous school might have handled it very differently than the new school. So making sure that they have an awareness on what that looks like is going to be really important. But I think it starts in the classroom, not just the mental health or the guidance counselor's office. And so it really starts with making sure everyone's on that same page. So I don't know if I answered that question. I actually forget what the question was because the cultural thing totally threw me off. So repeat it if you need to.
So one of the factors was the cultural thing, and then the other one was the how do we equip and help people expand their vocabulary to be able to ask questions in a way that is welcoming and because a lot of times children, teenagers, when they don't have that kind of knowledge or vocabulary, and they might be raised by individuals who don't believe or are not equipped with that vocabulary, which again continues to like that negative cycle of, okay, we're not talking about emotions, right? So how do we change the culture? How do we equip our children, ourselves, so that we're asking the welcoming questions or the most appropriate questions in those situations?
Yep. I guess I semi-answered your question then.
Yeah.
I really do think that it's important that we get this social emotional content. And we know that that helps. I know that in my state, that is a push right now, especially now with COVID-19, that's going to be even more of a push. We know that this is impacting people's mental health and peer relationships, and sometimes the bullying that we might have seen in the physical school environment, we aren't necessarily seeing. It's going to be online, or it's going to be in activities or outside of the school. So it's going to be a little different to adapt. Prior to COVID-19, my state has been working on getting the curriculum in the general classrooms and making sure that teachers, just like they have their professional development for education, they have professional development in trauma-informed care and bullying and social emotional aspects. So how do we get the vocabulary more integrated into the classroom, where it is okay to talk about how you're feeling? It's normalizing mental health concerns, normalizing talking about suicidal ideation, even normalizing talking about depression and anxiety and things that people experience, and doing it at an early enough age developmentally that this just becomes normalized and they can talk about it. A student being introduced to this as a first grader, that's going to look a lot different than it being introduced from a 12th grader, right? Where a 12th grader might be like, whoa, this is totally new. We've never talked about this in school, right? Like we've maybe had a conference on it once or a school assembly. Where if you just automatically start integrating this into the classrooms from an early age, the same way that you would integrate your typical academic curriculum, it's going to just be that natural progression where it's not going to happen overnight, but the more that it can be talked about in the classrooms and the more that adults can model it and show that behavior of even something as easy as I feel statements,
Right.
I feel sad because. It doesn't have to be this massive full-blown curriculum if some school districts don't have the funding to do so.
Right.
But it can start with just the general modeling behaviors of teachers, and that in turn changes the climate of the school, or that would be the hope that it would.
Yeah. And for me, and that was a great answer, because for me, it goes back to mental health advocacy, right? It comes back to not separating bullying from mental health, because as we know, and as the research shows, they are very much hand in hand. And although our adolescents and our young population, and even into young adulthood, a lot of times it's difficult to understand that link, right? One may try to come up with other reasons or examples of why they are feeling a certain type of way. And I think just having conversations about what these symptoms look like, what is not okay, how to identify this at a very basic level. And I love how you gave the example of, okay, if we introduce it at 11th grade, that's great that it's being introduced, right? It should be introduced. But if we do it at first grade and then second grade, and it's a part of the curriculum, it may not be a whole class, but at least 15, 20 minutes of what these things look like and what it could lead to, I think it could be extremely beneficial for the school environment and work environment.
Yeah. And I'm looking forward to meeting those children in the future. because they will definitely have a new vocabulary. It's going to be a new culture, and we're going to be the ones like, okay, what do I need to change now?
Yes, I have a lot of hope for our future generations.
Sorry. Okay. I'm gonna continue without you. One of the things that I was going to say here, and you alluded to, so it's the mental health consequences of bullying, right? And we talk about it in our series too. We talk about self-esteem, depression, anxiety, and also the likelihood of them re-experiencing bullying at adult during their like work environment and outside of work environment. Just because you experience bullying during your childhood years, then you're more likely to experience bullying in your adult years too, and not be equipped to handle that and continue to suffer from depression or having symptoms and whatnot. And so that again, you know, it tells us how important it is to instill like hope from an early age, and also to make systemic changes, you know, that apply to early age individuals, and provide the mental health support to all people, right? Adults and children and teenagers and whatnot, so that, and the elderly as well, let's not forget, because they also suffer from bullying too, ageism and whatnot. So it's a change in our vocabulary, a change in our behaviors that affects so many variables, and it's going to be a process for sure. But I think it starts with like the conversation that we're having today, the conversation that you're having with your colleagues and involved in, let's say, the school environment. Ron and I are talking, and hopefully other people will be will feel impacted in a positive way, so that it influences their behavior as well. And so that we can do more about one's mental health. We can do more about bullying too. And as you mentioned earlier too, we have to pay attention to, or we have to do, it's important that we do things to prevent bullying from happening, right? And I think we don't often talk about that side of the equation. And so what can we do more on that side of the equation?
Yeah, so you mean like from the bully perspective? Yep. So I think it's important that we look at the characteristics of what typically we see as being a bully. Now, that does not mean that it is only one set of, you know, someone fits all these this criteria and we put them in this box and it automatically makes them a bully. That's not the case. But we know typically, more often in males, or those who identify as men, we see that they it's more physical, more aggression, right? More of that oppositional, defiant behavior, where in females and in girls, we see it more in the verbal abuse, right? So men physical, women verbal. Typically do not like school. They have a hatred against school. They have volatile relationships with teachers or administration, low average grades. You know, they typically lower self-esteem, but that might come off as having very high self-esteem, or that they're very outspoken about you know, how great they are, or just very they model behavior that they are superior. There's a superiority to them, even though that might not be the case. So it's important that we look at all those things. We also know that for children in adolescence, something like depression is going to come across as irritability or anger, maybe not necessarily sadness and tearfulness. Not always, that's not always the case. But when we start seeing signs of depression or anxiety, it's important for us to think, is this something that is because of bullying, or is this the people who are doing the bullying? What does the home environment look like? You know, children who come from or who experience a lot of distress in the home environment, who have experienced traumatic events, there's a higher susceptibility for them doing the bullying. So I think it's very important that we make sure that we combat that aspect of it, not just the victims. It's also important that we look at active bullying and passive bullying. So we could have one person be the bully, but then there could be an entire crew of kids behind them who are just going along with it. And it's very important that we address that as well, not just that one person, because that one person can get in trouble for it, quote unquote trouble, But what happens to all the other kids who just witnessed it and didn't say anything? That's what's dangerous. That is what's really scary, is the people who are passively just allowing the bullying to occur. So I think, again, that comes back to teaching skills at a very early age. We know sometimes bullies have very poor social skills, so maybe doing some social skills training. Again, looking at that social emotional content, and also trying to have an awareness at every school year. And so again, I'm looking at school specifically because I work in that environment often. Getting to know the parents, getting to know what that home environment looks like, or getting to know the caregivers, so, right? It's not always parents. Getting to know the environment, and just what does that student go home to? What does that look like? What is their world when they are there? Because for a student, their entire world is home and school for the most part. It's not as expanded as an adult. They don't have as many, they have more restrictions and more limitations on what their world looks like. So I think it's important that we look at the entire scope, and what those kids are going home to, because that can often give us a very good idea of why they are the way they are, or why they're acting the way they are. I think on the last time that we connected, one of my favorite things is, instead of saying, why are you acting this way? It's, well, what happened to you? What happened that made you act this way, rather than what's wrong with you? It's not a what's wrong with you, or it's a what happened to you. And it's important that we look at that for the side of the bully too. It's just as important that we address what happens to the victim of bullying. It's equally as important that we look at who the bully is and who the passive bullies are as well, and making sure that we address that. We have to look at both sides. If we only do one side, nothing's going to actually change.
So. Especially if they're sent home and then nothing happens over there where they're learning more about their behavior, right? There's no conversation. Like, they go home, they're watching TV, and like, okay, it's good to go home,
Yeah.
So it's important to pay attention to the behavior, talk about it. Like, that means that the parents have the knowledge, they have the vocabulary to talk about it, and so that they can do something about it, to work with the child, or work with the teenager, so that there's change inside of the home as well as outside of the home. And I'm not saying it's easy. Again, we're talking about the ideal world, and let's continue to work to implement the ideal world.
Yep. No, I mean, that's a great point. I mean, it could be something as simple as offering parent training, where a counselor or someone who has experience in social emotional content offers, at this point with COVID, it could be Zoom sessions, it could be parent conferences, whatever that looks like. Because oftentimes parents might not realize that they're doing damage by not talking to their kids about, are you being the bully? Right? Like you said, they go home, they watch TV, everything's fine. Parents, oftentimes, apples don't produce oranges, in a sense that how that parent was raised, or what that parent has experienced, is going to influence what the child experiences, or how that child is raised. So it's important that we think of that as well, as what is this person being taught in the room, and what was that parent or that caregiver taught? So I think it's important that we look at the parent side too, and make sure that we allow some platform for them to access to get education, just like we want the teachers to be educated.
And you said it right, that the profile, like the characteristics of somebody who might sound like a bully, it doesn't fit like everybody who is a bully, right? And then so we sometimes think about, or see on media, TV, or whatnot, the perfect kids, right? That the parents believe that their kids are perfect, and at home they might act as like the perfect child in whatever their mind that perfect child means. But they would never believe that at school or whatever environment, they're acting in a way that's affecting somebody else's well-being. And so how do we resolve that cognitive dissonance over there, and then help them see without attacking them, or without them feeling attacked, right? Because a lot of parents think and they blame themselves for whatever's going on with the child. And so how do we also help them, I guess, reduce that guilt feeling, and also raise awareness that yes, your child is doing this, and your child looks like, a cool child at school because they're like as part of a team, or they look in a certain way that's acceptable at that school environment, but is engaging in like social exclusion, or if I don't like this person, then nobody else in my school like, or is making fun of somebody's appearance. So that is also bullying, right? As I mentioned. And how do we do this, right? Because their parents don't see that kind of behavior, do not believe that this child is engaging this type of behaviors.
That's a really good point. I like that you said the cognitive dissonance to it, because you're right. I mean, we see the children as they're the perfect child. There's absolutely no way my child would do that, right? It's very, very easy to approach it in the wrong way, and then automatically a parent has that defensive wall up, and they're not going to listen to a thing you say. So I think it's important that we gently approach it, but we have to be very direct about it, right? We can't sugarcoat it or sort of like skirt around the issue. I like to approach it as, this is what happened, or this is what was observed. But however, because, oftentimes, or at least in my experience, a child would come to me and I didn't see the bullying happen firsthand. So this is what I have been told. This is what was reported to me. This is how it's going to be handled. And we say, in the school environment, we're going to address it this way, and this way. I'm interested in your thoughts about, maybe what is happening in, Timmy's life, where has anything happened where maybe he's been upset about something, or, just gently approaching and trying to probe for some answers, or open-ended questions to get some answers as to maybe what's happening. It could be that, the parents just got a divorce and the child is very upset and angry, and then they're going to displace that anger, and it's happening in the school environment. So it's really nice to approach it where you aren't saying your child was the bully. It's, this is what we've observed to be happening. I'm wondering what your thoughts are, and if anything's going on, can we brainstorm together maybe a plan where we're in communication to make sure, if this continues to happen, that we're on the same page on how to address it. Not saying that it is your child's fault, your child did this, but more approaching it as, in this school or in this environment, this is how we will handle any situation of a peer or student coming to us saying that they've been bullied. So it's not singling the child out, it's saying that a general overall umbrella statement of, this is how we address it, and making sure that the parent knows that on the side of the bully and the side of the victim, that it's not just going to be that one-sided, or, again, we aren't just going to address it with the victim, we're going to address it with the bully too. And just saying that we're educating, it's all about educating, because a parent can't necessarily control in the moment if their child did something inappropriate in the school environment. We can't hold that against the parent. We just need to educate them. The biggest thing is psychoeducation that we can do, and really still approaching that gently and with curiosity and compassion. That's how we have to approach everything. If we come and we're judgmental against that student, they're not going to listen to a thing we say. So we have to approach it with curiosity and compassion, and an understanding that will be really hard information for a parent to hear. So we have to be in that brainstorm mode rather than a punishment mode. Punishment doesn't necessarily help anything in this situation. We also have to think about, what does that home life look like? We know that not always, but there are some characteristics where bullies are coming from a very authoritative, very strict environment where they have very strict, stringent rules. And then kids go into the school environment and they rebel a bit. So we always have to think about what, if we know anything about these parents prior to that conversation, really meeting the parents where they're at, in making sure that we are not attacking the parents, we are not attacking their parenting style, we're educating them. It's all about educating, it's not about reprimanding when it comes to the parents.
Thank you for that. We're reaching the end. Ronnie, do you have any more questions? Yeah. I know.
we've touched so many great aspects of bullying, and it's been so informative to me. But one thing that I did want to bring up very quickly, because I know we only have a few minutes left, but the idea of cyberbullying. So we've touched on it incrementally here and there, but cyberbullying, just a general definition, is the use of electronic communication to bully a person. And research has been pouring out in the past. I can point to one by Patchett and colleagues last year that showed that the cyberbullying has more than doubled from 2007 to 2019. And research really doesn't show any indication of that stopping, unfortunately, right? So social media is being pushed, text messaging, cell phones are now being used at a younger and younger age. So we're starting to understand different ways that cyberbullying can occur. And now we have this interesting combination of bullying in person in the school environment and possible bullying at home or in outside environments when they do have social media. I'm wondering, just in your experience and in the past few years, has that been a topic of conversation? And what are some things, what are some conversations that are going on around this topic?
Yeah, so that, I mean, cyberbullying, that's our future. Everything is going digital. And quite honestly, in the experiences I've had, the majority of the bullying cases that I've experienced are cyberbullying, because things happen so quickly. An inappropriate Snapchat or a inappropriate text message or something like that. Right. The problem is too, those things can be deleted, right? So someone can say, nope, wasn't me, didn't do it. I think it's very important, again, this, ideal world here, it is so important that before a child even has a phone or a computer or access to any digital platform, that we talk to them about appropriate behavior, inappropriate behavior, and the idea that nothing can stop a parent or someone from having access to that information. We can't just give a child who doesn't even have their brains aren't even fully developed and expect them to understand how to appropriately act on the internet, especially with our media and just watching TV and the way that people interact. We cannot expect that from a child. We have to teach them the appropriate behavior. We also have to teach them the consequences of it. They need to know what happens when they do these things. Right? Just the same way that we talk about in educating about consent, right? We have to tell them the consequences to these things, why it's important, and what can happen. So it doesn't necessarily fix it. Cyberbullying is going to only continue to be an issue, like you mentioned, but it has to start again with the education before that child has any access to anything, and right. Teach them the ways that they should go about it, and also monitoring it as well. It may be even limiting, if possible, how often they are able to be connected, anything from having parental controls on the phone to timed out or having the internet shut off at a certain time, right? Having structure around it before they get involved in it is going to be a lot easier to address than if they've had access to a phone or some digital platform in social media for years. And then all of a sudden you come in and say, we're setting this up, I'm restricting this from you, I'm taking this away from you. Naturally, they aren't going to be happy. Naturally, they're going to want to rebel. They're going to find ways around it. Kids are very smart. They're very curious. So it's almost a matter of time before a kid will get in trouble for doing something or saying something or doing something inappropriate. So we just need to inform them on what that behavior looks like, what's okay, what's not okay, and teach them. Mm-hmm. And I think it starts there. We have to always go back to the source and the root of the problem, right. Rather than just trying to do damage control when something bad happens.
Yeah.
Exactly.
Yeah, I mean, thank you so much. That answer covers so much. And I guess this whole conversation has been wonderful. And I didn't want to end because I still have more conversations. And I want to tell our listeners or people who are watching this on YouTube or IGTV that there's so much more to talk about. And we'll definitely bring you guys more episodes in the near future. Our bullying series, just like any other series, will be open and we'll continue to add into it on a later date. One thing, for instance, that I can think of on the top of my mind that we should talk about is how to react, right? When you are experiencing, when that is actually happening. what is the adaptive way to respond to it, right? And because we hear people, they want to retaliate, they want to, there's so many ways. And then so we want to talk about what research has shown that could be adaptive to you if you ever experience that and why not. And so with that, oh my gosh, I know I'm rushing here. I just want to say thank you again for being here with us, and hope you all stay connect with us on Instagram, Twitter, Facebook, and now we're on YouTube as well. So subscribe, and remember, let's connect.